Joanna Bensz, founder and CEO of the Longevity Center, with the center in Warsaw, but also opening soon in Zurich, and also one location in Germany, in Donau-Eschingen. So there was a lot of input. The Medicine Day, this is especially for you. What is your takeaway?
Well, this was the first time actually that we had so many doctors, but also so many topics around medicine. It was not only, the next few days are going to be very much about science, but today's day was especially important for people, anybody coming actually from the practical point of view. It's for doctors, by doctors, and around medicine, which I think is something that is really, really missing at the moment.
What you are offering concerning biomarkers, tests, epigenetic tests, also interventions. Did you get some inspiration?
I got definitely a lot of inspiration by other doctors. For us it's super important to compare what other clinics are doing. A lot of doctors are actually starting working with biomarkers, but we don't have enough yet data in terms of correlation. So we are very, very interested in observing the results of other clinics as well, and also see by other doctors which biomarkers work for them. And there's still so many unknowns. There's still so many information that we need to, let's say, prove, especially in terms of biological ages, how to work with them and make doctors work with biomarkers in a more effective way, and being more confident in working with biomarkers of biological age, because when you talk to doctors in the streets, they wouldn't know what to do with biomarkers of aging. They wouldn't know what to do with hallmarks of aging. So it's actually a conference that is giving us a platform for exchange of knowledge, information, and also experience.
And this, I guess, could be a challenge for you, for the Longevity Center, to educate physicians in longevity, healthy longevity interventions and diagnostics.
Exactly.
And this was a big topic also today.
Exactly. And a lot of the speakers were emphasizing how important it is to educate. And not only to educate doctors, but also to educate the decision makers, the influencers, but also the clients or the customers or the patients. Because this is a new field as well, and it's coming very much from scientific area and from science. And we need it now in medical practice. We need a lot of preventive doctors to start using longevity medicine as well, and some of the biomarkers that can not only focus on prevention, but also focus on how to make the customers actually live long, and what kind of interventions are effective and which of them are not effective. How to combine some of these interventions. Whether we should use metformin and rapamycin on everyone, or what kind of test should we do before we actually do it, and whether this is effective, whether we should do it all lifelong, or should we do it in certain stages of our life. So there's so many questions still unanswered, and I think we are learning very much from each other in this conference.
And your director of the Warsaw Center gave a short speech. You were happy?
He is, Dariusz is our scientific director. What we are also doing, we are doing a lot of, let's say, combination of different biomarkers, and we are trying to present results. At the moment, this is a pilot study of about 300 clients that we have evaluated, and now a lot of those clients are still undergoing interventions. So we will be able to present results of those interventions in about a year. So there will be even more detailed studies. But I think, this is the first time we were presenting in this way. So we are very, very happy.
So this kind of health business is really growing, and you feel it here.
I see a bigger need. I mean, this is my third or fourth ARTT, and I have never seen so many doctors, so many medical centers, and new longevity centers being open. I mean, a few years ago, it was just us and a few other people talking about longevity medicine. But now we have already 3 centers in hospitals, in a public system. There's more and more private longevity centers being open. And what we really need is some golden standards that we can follow and that clinicians are going to be happy with. And so that we, let's say, do not harm, but really focus on how can we improve the health span and lifespan of our clients.
So you will be in close contact further on with all these people who are doing that on a high level, evidence-based in research?
Oh, absolutely. I mean, we want to work with all those universities. We want to work also with all those public clinics. Private clinics have a little bit different challenge, focus and interest as well, because most of our clients are actually paying for the services that we offer. So we have to be especially diligent in terms of biomarkers that we select, because they question everything. So we have to make sure that everything that we do is actually scientifically validated. But to be effective, we have to work with other clinics, because we are not islands. We are all connected, and we are really learning from each other. So, but only for those that are really working with validated biomarkers.
Last question. During the coffee breaks, did you have could you get new contacts, and was something for you inspiring?
Yeah. There was a lot of inspiring contacts. There's a lot of younger and younger people coming to the sector, which I'm really very happy to see. There's a lot of people, we know each other from the conferences that were in the last few months, and so you can see a lot of the same speakers. But a lot of new contacts here during this conference, because I met a lot of doctors. I met a lot of actually people that are also interested in opening longevity centers. And this is new. This is something I haven't seen a few years ago.
This is a breeding ground.
Yeah, I think it's a very booming area. And not only we need clinics, but we need suppliers to clinics, we need new biomarkers, we need technology, we need platforms for AI and platforms for measuring and also tracking biomarkers. There's a lot of opportunities for people from outside of longevity sector to actually becoming providers to the sector. And I think this is something that we are just starting seeing as well. More and more new technologies, and also newcomers from other sector coming into the industry to provide services.
So you are early birds on a high level.
Yeah, we are very much early birds, but we are already bringing a lot of solutions into longevity, which were not before in longevity. And so we look at what biohacking is doing. We look at preventive cardiology. We look at preventive medicine. There's a lot of knowledge already from all those aspects of medicine that is focusing on prevention and on longer life and on vitality that we can bring into the longevity medicine.
You will do.
Yeah.
Thank you.
Thank you so much.